In this video, let me talk about the evidence-based practice, the definition and what does it integrate, scope, features, components, 6 steps, benefits, limitation or barriers, or the role of a nurse in the implementation of evidence-based practice. So evidence means it's something a proof, a scientific proof. So when you're going to see something, a good outcome of your research, so you can utilize the same thing in the nursing practice if it is scientifically proved. Okay, thus it guides the healthcare decisions. It identifies a good research findings, the best one, and implement the same in the nursing practice. This is all for what? To improve the quality of the patient care. The main goal of the evidence based practice is to provide a high quality and a cost efficient nursing care. The definition includes the evidence based practice is a problem solving approach to deliver the healthcare. It's a problem solving approach to deliver the healthcare that is used to review previous articles, analyze it, and translate or implement the latest scientific evidence. So translate, the word meaning here is implement. So you can implement the same if you find a trustworthiness. So what does it integrate? It integrates the best evidence available, and it includes nursing expertise, means in that particular topic or area the nurse become expert. The values and the preferences of the individuals, families and communities has to be emphasized. So what are the scope of evidence-based practice? It helps in taking decisions about the patient care. It identifies the knowledge gaps. So what do you mean by knowledge gap over here? It means a certain informations are known only by the people who are in a higher authority, and the lower grassroots people will not be able to know about it. But here, this evidence-based practice is the one which is being shared to all, and it has to be. Find scientifically evaluated knowledge. So you have a scientific proof in delivering the nursing interventions. It condenses, it gathers all the evidences that you have found it, and it helps you to assist in the clinical practice. So what are the features, which means characteristics of the evidence-based practice include, it is a problem solving strategy. For example, you take a research topic. So most of the topics will be the problem faced only. So and you try to solve it. This discourages the decisions which is based upon the custom. What is a custom? Which has been used for long terms, by the people. And when that is being transferred to the other generation, and that is called as tradition, that also has to be discouraged. Authority. Certain organizations, what do they do is they specifically say these are the things to be done without any rational do, and that also has to be discouraged. Intuition means it is like some sixth sense. So looking at one shot you judge something, and that's going to be wrong actually. Okay, opinion also. My opinion differs from others. And ritual, which is being keep on followed. This discourages, the evidence-based nursing discourages all these decisions which is based upon the custom, tradition, authority, intuition, opinion, and ritual. It emphasizes on identifying the best available research evidence. Means it finds out only the evidence, and it integrates, it involves it with the other factors too. It is based upon the knowledge evolving from the research. So you have to find out for the other researchers which has been already published. Okay, so you get information and knowledge from that article, and you can find, it is based upon the quality improvement also, and the risk data, and it compares the local, national, or international standards too. Cost effective analysis will be there in evidence based nursing. Benchmarking data, which means currently you are doing some procedure which is can be compared to the standards which is already been formed, the patient preferences, and as well as the clinical experience. So it is all based upon these factors. Then it makes an effort to suit a specific patient needs and the clinical situation. What are the components of the evidence-based practice? The first and the foremost is environmental, where you're going to do the research, whether it's going to be in the clinical area, education area, administrative area, depends upon that. Okay, but here we are going to talk only about the clinical area. Okay, evidence based is only mostly focuses on the clinical field. So environment matters a lot, and secondly is the organizational context. So you need a support from the organization to continue the research, otherwise it will be stopped, and again it will be a pain for you. So you need a best available research evidence, means a scientific proof evidence, and you need resources including the particular expertise, means a clinical experience. I mean the person who's expert in that topic, and the population characteristic needs, values, and the preferences, means you need to consider all those things, and finally you need to make a decision. So, in a simplest form, we could say it is the best scientific evidence, number one. Number two is clinical experience of the particular staff who's going to work in the particular topic. And the third is the patient values. So, what are the 6 steps in the evidence based practices? It includes select a research problem or clinical problem, form a team. Evidence retrieval means you're going to collect or recover almost information related to this. Okay, and evaluate the evidence, whatever you have got it, apply that evidence, and finally evaluate whether it has been efficient or not. Select a clinical problem. This is the first step in that, right? So when you're going to select the problem, you need to know what the priority is. Is the priority, otherwise severity has to be focused. Whether the topic can be applied to many or only few clinical areas, that also has to be considered. You need to get the support of an organization and the members of the medical team. Otherwise, it will be very difficult to run the program. You need to have a solid evidence available. Yeah, you need the medical team to agree totally this topic is going to be worthwhile. Then only you can proceed your research work in this. So you get the ideas from two things. Number one is a problem focused triggers. Triggers means it's something activate. Okay, so the problem will be focused over here, and the second is knowledge focus also. You can get the clinical problems from that. So let me know about what is the problem focused triggers which activates. Okay, so there are clinical problems and the risk management issues can be considered in this. And the clinical problems, where do you get it? It's identified through the quality improvement. If you want to improve something, so you can get a problem out of that. And the risk surveillance, where surveillance means something you're monitoring or you're scrutinizing, something like that. So you can get from that. And the recurrent clinical problems, which is running. And benchmarking data, you can consider the standards with the current procedure which is being done, and the financial data also, if it is going to be very costly, so we may miss the uh, patient also. So might be because they can't afford finance. So remember, when you're going to form a clinical problem or question, a PICO model has to be considered. So P stands for patient population, means the patient might be with a disease or some disorders. And I for intervention means that is you're going to give treatment to the patient, whether any procedure matters. And later, see, you compare it with the group which you have, experimental group which you have given the treatment, and the control group means you just going to observe the patient. Okay, and you're going to compare both the groups. Finally, you will get a solution of what the desired outcome is, whether it was right or wrong, then you can judge it. So, from the knowledge focused triggers, you could get that from reading the research, and you can get it from the conferences where scientific paper presentations can be done, and you can get it from the evidence based guidelines too, which has been published by the national agencies, otherwise, the organizations. So, it could be a new research findings that also can enable you to find a clinical problem, and the new practice guidelines also can trigger your selection. Then form a team. It's only for the successful and evaluation of the evidence-based practice. It helps the evidence-based practice to implement after doing a long sort of research work. And if it is rejected, that will be a painful, right? So in order to prevent that, you can need a team so that they will be able to understand the project and everything will be to bring out the desired outcome. The team must include representatives from the higher authority. It matters because you need a support from all higher authorities of the organization as well as the grassroots level members. Grassroots means it is a low level people. So where a project can't be only with the higher authority or with the grassroots, you need total together so that you can uh, finish your program. The team should be aware whether it is going to be low level people or high level people. The team should be aware of the type of patients that you're going to do the research and the settings where it is being taken and the interventions, that means the treatment that you're going to give and the outcomes too. The practitioners should educate the co-workers and clarify the doubts in the team, and they should clear the misconceptions too, just to bring out a best outcome. So evidence retrieval means a retrieval, means it's to collect the information. So you collect the information, I mean you can through the relevant literature from electronically or non-electronically, through journals. In literature retrieval process, you can use certain type of hierarchies, like for example clinical studies, systematic reviews, and evidence-based guidelines. So this will give you an idea to bring uh, important information for the research work. Then you can evaluate the evidence. So read the article closely, examine for the flaws, means ups and downs, if something is wrong or right or whatever it is. Examine it and use a rating scale. So check whether it is have a quality research. So assess for the recent or the current information. Don't go for 10 years back studies. Assess for the credibility, means worthfulness, whether your research is really worthful or truthful, and you find it out whether the quality of the article is. Determine the internal and the external validity. So validity means you are testing something. So internally you will test whether the procedure is worthfulness, and externally you can identify and you can choose it whether you can apply it for the whole lots of people, otherwise only for the particular group or whatever it is. So apply the evidence. Check for the uh, check or address for the risk benefit ratio. For example, if you're going to take a drug, it may have a side effects and it have some actions, a very good effect which is going to act upon the disease, right? If this is going to be benefit more, then you can choose it. If the side effect is less, is okay, fine. If this is going to be more, then you have to reject it. You can't utilize because of the side effect we may lose the patients. So that is why you need to address the risk benefit ratio and find out any harm is involved while implementing it, and check for the prognosis too. So the information gathered should always be shared with the fellow nurses and the researchers. This is very, very important. If you're going to find the research, the findings, so don't keep it with yourself. You need to share it so that it can be spread. Develop a work culture just to support implementation of these evidences, whatever you want to take care. Apply the evidence. It goes, the hierarchy goes like this. Okay, it begins from anecdotal to the systematic review meta analysis of RCTs. So what is anecdotal? Anecdotal means just only description of certain things. For example, you go to a bedside and you find a patient sitting over there. You find the signs and symptoms, whatever has been there. You're going to describe whatever you have seen and you have felt, you have auscultated, whatever you have done it. Okay, and this is the bottom of that hierarchy. And the next level is like ideas being shared by the researchers, the expert opinions of the particular field. Editorials will give you a message in this mostly in the journals, that you could find it out. Case studies means studying about the disease of particular patient or age group. So, for example, I could say neural tube defects is a case study that I can do with, and cross-sectional studies also matters. Cross-sectional is only one-time show it is, and case control means it is case. Uh, you have to find it out. I mean, it's mostly a comparable study whether the disease has been controlled or not. So that can be also done, and you can get the information from the cohort studies also. Group studies, group means like vulnerable group, you could say, whether it's going to be a pregnant lady, otherwise some patients who have immunocompromised AIDS patients or something, a group cohort. Okay, randomized control trial means like you can get a huge number of people and you select it. You have got techniques to select this randomized control. So you select some people and you run the research. Finally you will be able to get findings that will be more best. So you can get some systematic review and meta-analysis also, where this randomized control trials been involved, and more than 10 or 20 studies can be considered more valuable at this. So this is the evidence that you can apply it. So you can get the information from this sort of if you want to get information mostly from the systematic review and the meta-analysis, and that matters a lot. So evaluate the efficacy. How will you find out whether your procedure is being done good or not? It's by the clinical audit. So clinical audit might be internal or external also, like once in a year some organizations do, or once in 5 years they do it. So they check it out whether it's going to be done, the procedures being done is right or wrong. And they you can evaluate through the program evaluation also. After completing a research study, you can evaluate whether it is done right. You can find it by yourself also, like whether it's good or not. And you can get help of your peers, the colleagues, the same profession people, to find it out any flaws, means some ups and downs in that research implementation. Finally you can implement the same thing in the nursing practice. So this evidence based practice is undertaken to provide a safe, effective, and a cost appropriate care. So what are the benefits of evidence based practice are? So for patients, it has high quality and the cost-effective nursing care has been provided. And second, it results in the best patient outcome that increases the patient satisfaction too. So for nurses, you can read. It helps in reading the published articles in a specified area, so you get latest informations, and you can increase your efficiency also providing care for the patients. Whatever you do, it provides a rationale for all your nursing interventions, so that it develops your profession too. So nurses can communicate efficiently, effectively with the patients and healthcare team if they're going to have scientific proof in delivering the interventions. It also provides a legal accountability, where it can help you for the practice. So resolves problems in the clinical settings. It achieves excellence in the care delivery, even exceeding quality assurance standards also. So introduce innovation, something new. reduces the variations in the nursing care. You can compare with the north south people. I mean, the nursing care is different, so it is something equalized. Every nursing care procedures will be equalized. Unnecessary practices are eliminated, and ineffective practices replaced with the effective ones too. Assist with the efficient and the effective decision making that increases the confidence. So, what are the benefits for the health organizations? So, something called as a magnet status is being achieved by the hospitals in the US, where this is a recognition program. It acknowledges, I mean, it is makes you make the patient to understand the quality of the patient care and the nursing excellence and the new things which is being implemented in the nursing practice. So, being a magnet facility in the US, what does it mean is it assures the excellent nursing service. Since care is delivered based on the best evidence, so it is less likely to attract the litigations, means legal issues. Okay, and will be able to defend the care. This is the legal issues. It allows you to scrutinize or find out the practices whether it's going to be effective. Thus, it results in the significant cost savings. So, for community, the resources are preserved, but not wasting them on implementation of ineffective interventions. So, it ensures most effective care and limits the amount of disability and suffering of the people. So, what are the limitations or the barriers in the implementation of the evidence based practice? It resists to changes in the nursing practice. Even now, there are number of people who doesn't want to have a new change in the nursing practice. The more and more worst is the time. The workload pressures and competing priorities matters a lot. So they don't have a time for this evidence-based practice. So lack of continuing education programs through conference or webinars. So they don't have that facilities. Poor administrative support. If you don't have an organization support, it is difficult to run the program, and lack of support from your professional colleagues too. Lack of confidence if you don't have a knowledge related to the research field. You need to know about the research methods and the clinical evaluation skills before getting into the evidence based practice research. Otherwise, this will become a barrier. The overwhelming amount of information also matters a lot because you get a huge amount of information from the Google or the websites. So ultimately it may confuse. One research may say positive and the other one sort of negative, and ultimately making you to confuse. So shortage of research also in certain areas matters. So these are the limitations and the barriers which uh, is important in implementation of evidence-based practice. So this has to be overcome before getting into that. And finally, autonomy, independence. We don't have an independence in uh, implementing some procedures in the patient. Finally, the role of the nurse. So what you could do it, read widely and think critically. So attend some professional conferences, become involved in the journal club. Journal club means in a college or the where places are, they get together, one person present a journal topic, so that then people who the members of that journal club will be able to understand what that is, and they can have the latest informations with them. So make sure that you're going to pursue or participate in the evidence-based projects. So this is all about the evidence-based practice, and you could see the descriptions of the further topics in the description.